The House comes to questions for oral answer. Question number 1 in the name of the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What pressures are facing the public health workforce as a result of this government's decision to fund core Crown health expenditure to cover, quote, most but not all inflationary pressures?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, there's always a wide range of pressures in the health system, which is why we've increased Vote Health by $4.1 billion over our 7 years in government. One of the pressures facing the public health workforce is the need to constantly fact-check assertions made by a prominent public figure, including the false claim that access to
Order. Point of order, Grant Robertson.
This was a question on notice, a primary question on notice. The Minister has given an answer to it. It is quite clear where he is going with the second part of his answer. It's the same place. It's the same place he went with every answer yesterday, Mr Speaker, and it brings the House into disrepute as well as encouraging disorder.
Order. The member may be right as to where the answer is going. I, at this stage, cannot tell. But if the Minister is using it to simply attack a member of the opposition, I will take a very dim view of that answer. An answer can be given, but the opportunity to attack a member of the opposition is not necessary in the answer. Does the Minister wish to continue his answer?
Yeah, one of the pressures is the ongoing need to waste valuable frontline time checking false assertions.
We'll try this one then.
Order. Order.
Yes, no, you.
We just need less interjection from both sides. Supplementary question, the Honourable Annette King.
Supplementary question. Does it alarm him that by not covering all inflationary pressures, as he has admitted in this House, huge pressure is being put on staff, like senior doctors and dentists, with 75% of those surveyed in a study released today turning up to work with infectious illnesses so as to not burden colleagues or because of a lack of cover?
The Honourable Dr Jonathan Coleman.
Look, there's about 4 questions there, but the key point is actually this year inflation is running at 0.4% and we're funding inflation at 0.6%. So the funding is actually now ahead of inflation.
I wonder if you'll say that this afternoon. Supplementary question,
the Honourable Annette King.
What was his reaction to the September 2015 Auckland DHB staff survey results showing 69% of respondents believe the message they're getting from the organisation is that achieving volumes, targets and budgets is more important than staff wellbeing and the quality of the work environment?
The Honourable Dr Jonathan
My
Coleman.
reaction was to go and check the facts.
Point of order, Mr Speaker.
Order.
Point of order, Mr Speaker.
Order. Point of order, the Honourable Annette.
Point of order, I seek leave to table the said survey. I point the Minister to page 10.
There's no need to do that. Member Woolwich, order. There is no need to do that part. The member can seek leave to table the survey. I just need the date of it and I will put the leave.
Yes, the date of it is September 2015, Auckland District Health Board CCDM Program Discovery Report, page 10.
Order. The document has been described. I will put the leave. Order. I need to put the leave. Leave is sought to table that particular staff survey. Is there any objection? There is none. It can be tabled. Supplementary question, Marama Fox.
Thank you, Mr Speaker. To the Minister, does the Minister understand that amongst New Zealanders aged 50 to 64 years, Māori are approximately 5 times more likely to die from COPD, and Māori women are apparently the worst in the world? If so, what is the Minister doing about that situation?
The Honourable Dr Jonathan Coleman.
Yes, look, COPD, chronic obstructive pulmonary disease, is caused by smoking, and that's the reason why we've massively increased the taxes on cigarettes to try and decrease those rates. Smoking rates have decreased by 25% under this government, but there's still much more progress we need to make, especially amongst Maori women.
Supplementary question, the Honourable Annette King.
Is a pattern emerging in health with an overworked and stressed workforce leading to mental health staff in Auckland on strike, medical physicians preparing to strike affecting cancer services, staff working unpaid hours and annual leave not being taken, and doctors and dentists working unwell, stressed and fatigued?
The Honourable Dr Jonathan Coleman.
No, the only pattern emerging is the need to constantly go back and check the facts.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Order. Supplementary question, the Honourable Annette King.
Thank you, Mr Speaker. Would the Minister like to check this fact? Is the President of the Association of Salaried Medical Specialists, Dr Heinz Stander, right or wrong when he said today the environment senior doctors and nurses are working in is increasingly toxic?
The Honourable Dr Jonathan Coleman.
No, that's a press release by the ASMS, which was done in conjunction with Mrs King. I've checked that fact.
Point of order.
Point of order, Mr Speaker. The Minister cannot accuse another member of working with anyone, and that is a total lie.
Order. Then the member's been here a long time. She knows how to handle it. I refer her to Standing Order 359. Supplementary question, the Honourable Annette King.
Why would staff feel supported and valued when the lowest paid in DHBs, the cooks at Middlemore, many who have worked for more than 40 years, not only lost their jobs but their retirement income entitlement because of the government's failed HBL experiment and despite the promises?
The Honourable Dr Jonathan
Well, look,
Coleman.
I'd really have to go and check those facts. But what I can say is we took very strong and urgent action on HBL, and that member knows that actually there was a need to save $300 million across the health system, and her answer would be to run a deficit. We've actually taken action which makes the health system sustainable. But Grant Robertson will run deficits, and if that's the way you want to run your fiscal policy,
I think
so
the
be it.
question's now been answered. Order. Supplementary question, Madam Fox.
Thank you, Mr Speaker. To the Minister, can the Minister tell us why COPD is not a national health target under the current government?
The Honourable Dr Jonathan Coleman.
Because there are 6 national health targets, but at a sub-target level, it is included, I believe, in district annual plans.
Order.